You were doing fine at first. Everything felt right. But then, just a few minutes in, you felt it slipping away. The firmness faded, and suddenly you're left feeling frustrated, confused, maybe even a little scared that this might keep happening. If that sounds familiar, I want you to know something important. You're not alone, not even close. Well, I'm Dr. Naraya Wolf, urologist and pelvic surgeon. And if you've ever faced questions or concerns about your sexual health, about why your body isn't responding the way you'd like it to, please stay with me. We're here to help you understand your body with clarity, compassion, and real solutions. This is one of the most common concerns I hear in my practice. Men who can achieve an erection just fine, but can't keep it during sex. It's frustrating, it's deeply personal, and honestly, it's more common than most people realize. Today, I'm going to walk you through 7 clear reasons why erections fade during intimacy. And more importantly, I'm going to give you 8 practical, evidence-based steps you can take to regain control and confidence. Understanding how erections actually work. Before we talk about why things go wrong, let's take a moment to understand what's happening when things go right. An erection is a beautifully coordinated event. It's not just physical, it's vascular, neurological, hormonal, and even emotional. Everything has to work together. It all begins in your parasympathetic nervous system, the part of your body that kicks in when you're calm, relaxed, and feeling safe. When you experience sexual arousal, your brain sends signals down through the pelvic nerves. These signals reach the smooth muscle cells lining the blood vessels inside your penis, triggering the release of a molecule called nitric oxide. Nitric oxide is the key messenger. It tells the penile arteries to relax and widen. When they do, blood rushes into the spongy erectile tissue, called the corpora cavernosa. As this tissue fills with blood, your penis becomes firm. But here's the thing, blood flowing in is only half the story. At the same time, tiny venous valves inside your penis have to close tightly. Their job is to trap the blood inside, preventing it from draining back out. If those valves don't seal properly, a condition we call venous leak, the blood escapes too quickly and the erection softens. So for a strong, lasting erection, you need smooth muscle relaxation, healthy arterial dilation, proper venous compression. All 3 must happen in perfect coordination. Research shows that men with higher nitric oxide levels achieve firmer, faster erections. The more nitric oxide your body produces, the better your vascular response. But here's where aging comes into play. As we get older, our body's ability to produce nitric oxide naturally declines. Studies show that between the ages of 40 and 70, nitric oxide production can drop by as much as 50%. That's one of the main reasons erectile function weakens with age. Your penile arteries simply don't receive the same strong, clear signal to relax and open up. But, and this is important, declining nitric oxide is not a life sentence. You can improve it, you can restore function. I've seen it happen countless times in my practice. There are evidence-based interventions, natural compounds, lifestyle changes, targeted supplements that can dramatically boost nitric oxide production and even reverse venous insufficiency. For example, French maritime pine bark extract has been shown in clinical trials to improve nitric oxide synthesis and reverse chronic venous insufficiency. Venous insufficiency is when the valves in your veins leak, causing blood to drain out too quickly during sex. One study found that this extract improved endothelial function, the health of your blood vessel lining, and increased nitric oxide availability, leading to better blood retention and firmer, longer-lasting erections in men with vascular disease. When you combine the right supplements with the right lifestyle habits, you can see dramatic improvements in your ability to achieve and maintain an erection. The key is understanding that erectile function is fundamentally a matter of vascular health, nerve function, and hormonal balance, all working together. The 7 reasons you're losing your erection during sex. Now that you understand how erections work, you can see how delicate this balance really is. If the nerve signals get interrupted, if blood flow weakens, if you become mentally distracted, your erection can fade. But here's what I've learned after years of treating men with erectile dysfunction. In most cases, you can regain control. Let me walk you through the 7 most common reasons men lose their erections during sex, backed by clinical research and my own experience. Reason number 1, gravity is working against you. This is something most doctors don't talk about, but it's biomechanically significant. The position you're in during sex matters a lot. If you're lying on your back with your partner on top, gravity is pulling blood away from your penis, not toward it. This becomes a real problem if you have even a mild venous leak. Venous leak is when the valves inside your penis don't close all the way, allowing blood to escape during an erection. It's more common as you age or after penile trauma. When gravity works against you and your veins aren't holding blood in properly, you're fighting an uphill battle. Reason number 2, psychological factors and mental distraction. Erectile function isn't just physical. Your brain is your most important sexual organ. Research shows that in younger men especially, up to 60% of erectile dysfunction cases are primarily psychological. If your mind is racing during sex, am I doing this right? Is my partner enjoying this? What if I lose it again? That mental noise literally activates your sympathetic nervous system. And the sympathetic nervous system is the opposite of what you need for an erection. It's the fight or flight response, and it shuts down the parasympathetic relaxation response that keeps you hard. Reason number 3, declining penile sensitivity with age. As we age, the nerve endings in the penis become less sensitive. A study in the British Journal of Urology found that penile sensitivity can decline by up to 30% between the ages of 40 and 70. These tiny sensory nerves can be damaged over time by diabetes, cardiovascular disease, or even mechanical trauma. The blood vessels also lose elasticity, so they don't dilate as effectively. When sensation decreases, stimulation decreases. And without enough stimulation, you lose your erection during sex. Reason number 4, insufficient arousal or mental engagement. Sometimes your body is present, but your mind isn't. If you're not fully psychologically aroused, your brain doesn't send a strong enough signal to maintain the complex vascular and neurological processes needed for a sustained erection. This can be influenced by stress, relationship tension, depression, or even distractions in your environment. For optimal erectile function, arousal needs to be both physical and mental. Reason number 5, performance anxiety creates a self-fulfilling prophecy. This is one of the most common patterns I see. If you've lost an erection during sex even once, the fear of it happening again can cause it to happen again. Performance anxiety activates your sympathetic nervous system, the fight or flight response, and that's the exact opposite of the parasympathetic relaxation you need for an erection. A study in the Journal of Sexual Medicine confirmed that psychological factors, especially performance anxiety, are among the strongest predictors of erectile dysfunction. Reason number 6, cardiovascular and vascular health issues. Your overall cardiovascular health directly impacts your erectile function because an erection is fundamentally a vascular event. Conditions like high blood pressure, diabetes, high cholesterol, and atherosclerosis can damage the delicate blood vessels in your penis. A study in the American Journal of Cardiology found that erectile dysfunction often appears 3 to 5 years before cardiovascular disease, making it an early warning sign of vascular problems. Reason number 7, hormonal imbalance, especially low testosterone. Testosterone is essential for libido, erectile function, and penile sensation. Starting around age 30, testosterone levels decline by about 1% per year. Many men experience a corresponding decline in both erectile quality and sexual desire. The 8 evidence-based solutions to keep your erections strong. Now let's talk about how to fix this. Here are 8 proven, practical steps you can take to regain control over your erectile function. Solution number 1, empty your bladder completely before sex. A full bladder can compress the pelvic nerves that control erections, interfering with the nerve pathways essential for maintaining firmness. This is basic anatomy, but it's often overlooked. Solution number 2, choose positions that use gravity to your advantage. Standing, kneeling, or positions where your partner is on top help gravity keep blood pooled in the erectile tissue. This is especially important if you have even mild venous leak. Solution number 3, prioritize adequate foreplay for both partners. When your partner is fully aroused, you naturally receive more stimulation, and that helps maintain erection strength. Plus, when your partner is ready, you don't have to work as hard or as long to maintain your erection during penetration. Solution number 4, avoid alcohol before sex. Alcohol is a central nervous system depressant. It can seriously impair the nerve reflexes needed to maintain an erection. It also causes dehydration, reducing blood volume and affecting erection quality. Clinical studies show that even moderate alcohol intake can reduce erectile function by up to 25%. Solution number 5, strategically space out ejaculation. After orgasm, your body needs time to replenish neurotransmitters, hormones, and energy reserves. The optimal frequency varies from person to person, but many men over 40 find that spacing ejaculations 7 to 10 days apart improves both erection quality and sexual stamina. Solution number 6, consider using a constriction ring or cock ring. These devices apply gentle pressure at the base of the penis, physically preventing blood from draining out. This makes it much easier to maintain firmness. If venous leak is part of your issue, this can be especially helpful. From a medical standpoint, these devices are safe and effective when used correctly, and they can complement other treatments. Solution number 7, implement a comprehensive vascular support protocol. For long-term improvement, you need to address the underlying vascular and hormonal factors affecting erectile function. This includes optimizing cardiovascular health through exercise, proper nutrition, and targeted supplementation. Ingredients like French maritime pine bark extract, L-arginine, and pomegranate extract all have clinical research supporting their benefits for erectile function. Solution number 8, address sensitivity issues through multiple approaches. Restoring penile sensitivity requires a multi-pronged approach. First, make sure your testosterone levels are optimized. Low testosterone is directly linked to reduced sensation and sexual responsiveness. Second, consider devices that deliver controlled vibration to penile tissue. Research shows that vibratory stimulation can increase local nitric oxide production and improve nerve sensitivity. Third, focus on improving your whole body nitric oxide levels through diet, exercise, and appropriate supplementation. Sensitivity decline is usually the result of a combination of factors: age-related changes in penile vasculature, reduced nitric oxide production, poor circulation, and loss of elasticity in erectile tissue. A word about supplements. Before I close, I want to say something important about the supplement market. It's flooded with overhyped, underperforming products, especially those sold through adult websites or spammy ads. Many are low quality, underdosed, or even unsafe. That's why I only recommend a small number of clinically validated supplements that I've seen work in my patients. Products that contain the right ingredients, in the right amounts, from companies that actually test their products for purity. The 4 I recommend are L-citrulline from watermelon extract for improved blood flow, saw palmetto for prostate health support, zinc to maintain healthy testosterone levels, ashwagandha to reduce stress and boost libido. These are supplements I would recommend to my own patients. They're safe, effective, and worth your time. In my clinical experience, the men who see the greatest and most lasting improvements in erectile function are those who take a comprehensive approach, addressing vascular health, hormonal balance, psychological factors, and mechanical considerations all at once. The key is understanding that erectile dysfunction is rarely caused by just one factor. It's usually a combination of vascular, neurological, hormonal, and psychological elements, and you need to address them systematically. Remember, erectile function is a vital indicator of your overall health. Taking care of your sexual health is also taking care of your cardiovascular health, your energy levels, and your overall quality of life. If you're experiencing persistent erectile issues, please don't struggle alone. These problems are incredibly common, highly treatable, and nothing to be ashamed of. What I see every day as a urologist is this: With the right approach and a commitment to your health, men can overcome these challenges. Take care of yourself, you're worth it, and you deserve a lifetime of confident, satisfying sexual health.